Have you ever wondered how beta blockers, those remarkable little pills, help manage conditions like hypertension, arrhythmias, and even migraines? Well, buckle up, because today we're diving deep into the fascinating world of beta blockers, unraveling the mystery of how they work, and shedding light on their key points. Beta blockers, also known as beta-adrenergic blocking agents, have a rather ingenious way of operating. Their primary function is to block the action of epinephrine, also known as adrenaline, on the beta receptors of the sympathetic nervous system. This system is responsible for the fight or flight response, which, when triggered, leads to increased heart rate and blood pressure. By blocking these beta receptors, beta blockers slow the heart rate and reduce the force with which the heart contracts, ultimately lowering blood pressure. Now, beta blockers can be selective or non-selective. Selective beta blockers, like bisoprolol and nebivolol, mainly block beta-1 receptors found in the heart. Non-selective beta blockers, like propranolol, block both beta-1 and beta-2 receptors. The latter are found in various organs, including the lungs and blood vessels, which broadens the impact of non-selective beta blockers. Let's talk dosage. For bisoprolol, a standard dose might range from 5 to 20 milligrams daily, depending on the condition being treated. Nebivolol usually starts at 5 milligrams per day, while propranolol dosing can vary widely, from 20 to 240 milligrams per day, again depending on the condition. Beta blockers, like any other medication, aren't free from potential interactions with other drugs. For instance, combining them with calcium channel blockers can intensify the effect of slowing the heart rate, which might lead to heart block in some patients. They can also interact with insulin and other diabetes medications, potentially masking the signs of low blood sugar. Side effects, while usually manageable, can include fatigue, cold hands and feet, slow heartbeat, and weight gain. Less common but more serious side effects may include shortness of breath, difficulty sleeping, and depression. As for when to stop or hold these drugs, it's vital to remember that sudden withdrawal can lead to serious complications, including a sudden spike in blood pressure or even a heart attack. Therefore, any decision to stop or adjust the dosage should always be under the supervision of a healthcare provider. To sum up, beta blockers are a group of drugs that work by blocking the action of adrenaline on the heart and blood vessels, thereby slowing heart rate and reducing blood pressure. They can be selective or non-selective, have potential interactions with other drugs, and can cause a range of side effects. It's essential to never abruptly stop taking these medications without consulting a healthcare provider. So, there you have it, a quick yet comprehensive look at beta blockers. Remember, understanding how drugs work is the first step towards using them effectively and safely. Until next time, stay curious and keep learning.